How's it going, guys? We have a past level question, pharmacology, step 1, family medicine, 2CK, 26-year-old woman, 1 month history, unusual discharge per vaginal and wet mount is shown. Question wants to know the mechanism of action, the most appropriate pharmacologic treatment. So our first sentence here, very vague. It could refer to a myriad of infections. Our second sentence, wet mount is shown. This is our first point of value. This could refer to two pathologies in USMLE. So the first is going to be trichomoniasis, Trichomonas vaginalis, which is a flagellated protozoan. It's going to cause a yellow-green discharge, can cause colloquially a strawberry cervix, which is an erythematous cervix with punctate hemorrhages. Also an erythematous vaginal canal. You're going to give metronidazole for patient and partner. The second thing wet mount is going to be is bacterial vaginosis, Gardnerella vaginalis, showing us clue cells, which is what we have here, which is a squamous epithelial cell studded with innumerable bacteria. Very passive image, causes a thin gray watery discharge and a fish-like odor the patient will complain of that's accentuated with a KOH prep. It's called the whiff test. Let's just hop to the answer choice here. Choice A, 50S inhibitor alone, wrong fucking answer, refers to azithromycin, which would be used if we had isolated chlamydial infection, meaning you've got a boy, gal who has mucopurulent discharge and no organisms grow. That's how chlamydia is described because it's obligate intracellular, so you're not going to be able to grow any organisms. And you can often just give azithromycin alone to treat it. Now, some students are going to ask about the elephant in the room, which is co-treatment. Choice B, wrong fucking answer. So this is azithromycin alone plus ceftriaxone. This is how we treat gonococcus, because gonococcus is gram-negative diplococci. So you're going to, if you visualize it in the urine / on discharge, the gram-negative diplococci, clearly you have to give the IM ceftriaxone to treat it, but you have no way of knowing whether the chlamydia is also there or not. So you have to still treat for the chlamydia anyway. Now, it gets annoying because on a couple of the new 2CK questions floating around, they ask about treatment for gonorrhea, and the answer is ceftriaxone alone, and that confuses students because they say, wait, I thought we were supposed to co-treat. I agree with you. And if they happen to list choice A, co-treatment, choice B, ceftriaxone alone, you're obviously going to choose co-treatment. But there's a couple questions where they just have singular drugs for all the answer choices. No mention of co-treatment. So don't get confused. Just obviously it's ceftriaxone for gonococcus, and if they had a co-treatment, you would give it, which is with either azithromycin, the 50S inhibitor, or doxycycline for a week, which is your 30S inhibitor. So, but for chlamydia alone, you don't have to co-treat for concurrent gonococcus. Now, let's just hop to the other answer choices here. Choice C, DNA synthesis inhibitor causing chain termination, wrong fucking answer. So this refers to acyclovir, treatment of herpes. Okay, so that's literally the mechanism of acyclovir. And you need to know resistance to acyclovir. It's going to be altered or absent viral thymidine kinase. Don't confuse tangentially with ganciclovir. Okay, it's the same mechanism of action, but that's for CMV. So it's going to be very painful vesicles on the gynecologic area or on the penile scrotum, etc. And so that's going to go latent in the sensory nerves. And initial infection can cause regional lymphadenopathy, fever, and then the herpetic / post-herpetic neuralgia that will come with recurrent episodes. A lot we can talk about. Wrong fucking answer. Choice D, formation of toxic metabolites, damaged DNA. Correct answer refers to metronidazole, which is how we treat bacterial vaginosis. Okay, Gardnerella vaginalis. Don't really know what to tell you. It's not dramatic, not rocket science. Choice C, wrong fucking answer. Inhibition of P450 mediated demethylation refers to azoles, okay, fluconazole. So in theory, if we're going to treat vaginal candidiasis, we can use topical nystatin, which pokes holes in the ergosterol membrane. But if they ask for an oral agent, it's on one of the step 1 NBMEs. They say an oral agent is used to treat vaginal candidiasis. And the answer is P450 mediated demethylation reaction. So azoles inhibit the conversion of linosterol to ergosterol, and that enzyme is 14-alpha demethylase. Candida, obviously thick white cottage cheese discharge. 4 out of 5 questions. 1 out of 5 questions, they're not going to mention that discharge. The student gets confused. They might just say there's an erythematous vaginal canal and an itchy irritation. That's all they say. And then you're able to eliminate the others to get there. Choice E, wrong fucking answer. You know the deal. To make more content, if you'd like to subscribe my channel, I appreciate your time. That's it.